New antibody treatment shows promise for HER2-positive breast cancer. A new antibody-based drug, trastuzumab emtansine, TDM1, is emerging as a viable alternative to traditional chemotherapy for women with early-stage HER2-positive breast cancer. A recent clinical trial demonstrated that approximately 98% of patients treated with TDM1 remained cancer-free 3 years after treatment, a rate comparable to standard chemotherapy, but with significantly reduced side effects. This shift towards more targeted therapies is reshaping how breast cancer treatment is approached. Understanding HER2-positive breast cancer. Roughly 20% of all breast cancers are HER2-positive, meaning they grow faster due to an overactive protein. Over the last 2 decades, targeted therapies focused on HER2 have drastically improved patient outcomes. The key advantage of this approach is precision. It directly attacks cancer cells while minimizing harm to healthy tissue. TDM1 builds on this progress by using an antibody to deliver chemotherapy directly to tumor cells. The ATEMPT trial results. The ATEMPT trial, involving nearly 500 patients across the U.S., compared TDM1 to the standard treatment of paclitaxel plus trastuzumab. While overall side effect rates were similar, 46% versus 47%, the nature of those side effects differed substantially. Patients on TDM1 reported significantly less nerve damage and hair loss, common and debilitating effects of paclitaxel. Conversely, TDM1 was more likely to cause low platelet counts or liver changes, leading to more treatment discontinuations, 17% versus 6%. The trial found no statistically significant difference in cancer recurrence rates between the two groups. Approximately 98% of patients receiving TDM1 were alive and cancer-free after 3 years, compared to 94% on standard chemotherapy. This suggests that TDM1 is at least as effective, with a distinct trade-off in side effect profiles. Evolution of HER2 treatment. From chemotherapy to precision, the journey of HER2-positive breast cancer treatment has evolved dramatically. The introduction of trastuzumab alone was a breakthrough, followed by combining it with chemotherapy to further reduce recurrence rates. However, the toxicities associated with chemotherapy, such as nerve damage and hair loss, remain a significant concern for many patients. TDM1 represents the next step, a more targeted approach that minimizes systemic exposure to harsh chemotherapy drugs. Implications for patients and clinicians. The ATEMPT trial does not replace current standards of care, but it expands the options available to patients and physicians. The choice between TDM1 and traditional chemotherapy now hinges on individual patient preferences, weighing the benefits of reduced nerve damage and hair loss against the risks of liver problems and low platelet counts. As survival rates continue to improve, treatment decisions are increasingly incorporating quality-of-life considerations. Ongoing research is exploring shorter TDM1 courses to maintain efficacy while reducing discontinuation rates and cost. Longer follow-up from the ATEMPT trial will provide further insight into long-term outcomes. Ultimately, this study signals a more personalized future for cancer care, where patient experience and well-being are valued alongside survival.